It's all about the patient. Or at least about keeping patients and the revenue generated for their medical care. As healthcare is rocked by deals aimed at shattering traditional boundaries between businesses, some of the nation's biggest hospital groups are doubling down on mergers that seem much more conventional. Skeptics say some of these hospital deals are more of the same, systems seeking to increase their leverage with insurance companies and charge more for care. In just the last few weeks, several of the nation's largest non-profit hospital systems have announced plans to become even larger behemoths. Dignity Health and Catholic Health Initiatives said they plan to become a national chain of Catholic hospitals and clinics that span 28 states. Two Midwestern systems want to combine to become one of the country's largest non-profits, and Ascension, which is already the nation's largest non-profit health system, is said to be in talks to become even bigger, according to the Wall Street Journal. Ascension declined to comment. But the frenzy of mergers and other alliances taking place also reveals a frantic attempt to court and capture patients as people have more choices about where to go for care. Patients are increasingly relying on walk-in clinics, urgent care centers or an app on their cell phone to check out a nasty rash or monitor their diabetes, and they are looking for places that are both less expensive and more convenient than a hospital emergency room or doctor's office. The battle is over the control of the patient, said Rob Fuller, a healthcare lawyer at Nelson Hardeman and a former hospital administrator. As hospital executives see the continued decline of care being delivered within a hospital's four walls, he said they want to make sure they still have a say over where patients go after a hospital stay or to get treatment for a chronic condition. Hospitals competing for patients is a game of musical chairs, and there might not be a chair for you, agreed Kenneth Kaufman, chair of Kaufman Hall, a firm that consults with hospitals. Hospital executives are realizing that someone else, including an insurance company employing the nurse at a walk-in clinic or the doctor at a surgery center, wants to take over their relationship with patients, and the potential revenue that those patients represent. And the move by the insurers into their traditional territory is making some institutions very nervous. United Health Group, the giant insurer, is viewed as the greatest threat, underscored by its recent purchase of Divider Medical Group. The company, which has a diverse portfolio of healthcare businesses, already has a roster of some 30,000 doctors under its Optum unit, and a chain of surgery centers. The company has moved out ahead from a competitive perspective and a model perspective, Mr. Kaufman said. The proposed merger of CVS Health, which operates drugstores and a large pharmacy benefit manager, with Aetna, an insurer, also promises to reinvent care by transforming CVS roughly 10,000 drugstores into healthcare hubs, where patients can easily seek advice or treatment for anything from a sore throat to heart disease. There is also the rumor that Amazon, which has already upended retailers like bookstores and grocery chains, could enter the pharmacy business.